National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, I'm Dr. Jonathan Beattie, naturopathic doctor and a health expert here at nationalnutrition.ca. Do you or someone you know suffer from anxiety? Anxiety can be a very debilitating symptom or condition that somebody experiences. It's often characterized by a feeling of nervousness or what we would call anxiousness. You can have excessively sweaty palms or feet, or excessive sweating from other areas of the body. You can have palpitations or changes in your heart rate, and you can even have trouble with breathing, shortness of breath, and a variety of other symptoms, right down to upset stomach, and even severe anxiety can cause things like diarrhea and constipation because of the impact the nervous system has on the intestinal tract. So if you suffer from anxiety, there are a few things you can do. First thing you want to do is try and figure out exactly what's created your anxiety. Now, your response to stress in your environment, it can be impaired when a gland above your kidneys called your adrenal gland is not functioning appropriately. This can often lead to the development of anxiety symptoms because your stress response is impaired and your body can no longer respond to the stresses appropriately. This can have two effects, either an overly heightened response to stress, or sometimes your adrenal gland will just go off untriggered and you'll start to experience an anxiety attack or an anxiety response to pretty much no trigger at all, where it'll be a spontaneous response. So if you're experiencing that, you need to do some adrenal support to support the system that controls and regulates your anxiety. So if you do have anxiety, there's a few things you can use to help manage it. Obviously, understanding what your triggers are and avoiding those or dealing with those is a very effective way. Some people will do something called cognitive behavioral therapy. What this is it's a psychiatric or a psychology technique whereby you start to understand what triggers your anxiety so that you can help control those scenarios and experience less anxiety. Other ways that you can help control your anxiety are through diet. Certain nutrient deficiencies can actually manifest as a feeling of anxiety. So oftentimes being deficient in your B vitamins, specifically B12 and B6, can sometimes manifest as a feeling of anxiety. A lack of magnesium in the diet can actually cause symptoms consistent with anxiety. And of course, once you start to feel these symptoms, you get anxious about it, and that actually causes a vicious circle or downward spiral where the very onset of a feeling of a symptom like anxiety can actually then trigger an anxiety attack. So there are a few medications that people can use to help manage acute anxiety attacks, but again, these are only managing the attacks. They're not actually getting at the reason why you experience anxiety. As I mentioned, it could be a nutrient deficiency, and it could be actually a trained response. Again, oftentimes people who suffer from other conditions such as post-traumatic stress disorder can experience anxiety as one of the symptoms of that. So if you have past histories of traumas, resolving those traumas and resolving your emotional experience can be very important for getting control over your anxiety symptoms. Now, in addition to that, there's a variety of different neurotransmitters that if you modulate or supplement with, you can actually help to control your anxiety. So one of the ones that I really love for helping people with anxiety is something called 5-HTP. And the reason 5-HTP or 5-hydroxytryptophan is so important or so effective is because it helps your body to produce a calming neurotransmitter called serotonin. It's very safe to use. The reason I like 5-HTP is you don't have the same level of side effects that you get with the medications that affect serotonin. And so because of that, I always like it as a first level intervention because of its higher safety level. In addition to that, you can use an inhibitory neurotransmitter called GABA, or gamma-aminobutyric acid. Now this is a neurotransmitter that our body produces, and sometimes it can be low in people, and so therefore we need to help supplement them with GABA. In fact, recent studies have shown that there's certain type of bacteria that can live inside of you that actually feed off of GABA, can cause low GABA levels, and we're predicting that that might actually be associated with some people's anxiety and why they experience it. So thereby supplementing with GABA can actually improve the GABA levels in the body, leading to a sense of calm and getting rid of the anxiety symptoms. I also like a couple of herbs for the treatment of anxiety. One of my favorites is a herb called holy basil, or Oxymum sanctum. And the reason I love this herb is that it's very good at providing a sense of uplift and calm. It's very good at stabilizing blood sugars, and actually blood sugar instability can be associated with a sense of anxiety. And it's actually known in Ayurvedic medicine as Tulsi, or the Immaculate One, because of its intense ability to control nervousness and provide a sense of calming. And so therefore I've found holy basil to be very, very effective at helping people manage their anxiety. And because of its safety, it's almost like a food product. You can use very, very high doses of it with very minimal effect. The only time you ever have to really be worried about it or watch it is it can actually lower blood sugar. So if you do start to feel symptoms of low blood sugar, it's important that you manage that. And typically just eating a little bit after you've taken some holy basil can help prevent that side effect from occurring. Additionally, I also like using a herb called rhodiola. Rhodiola is very good at supporting the adrenal glands, and it's again used to help maintain and manage anxiety symptoms and repair the adrenal gland, or repair the reason why you're suffering from anxiety in the first place. Now, dietary factors can also play a role in your anxiety. There's a number of different ways this can happen. Probably one of the most common ones I see in my practice is when people ingest foods that they can't digest properly, or they get manipulated by the gut bacteria into things called gluteomorphin and caseomorphin. So this is where gluten and a protein in milk called casein get improperly digested. They become these what we call opiopeptides, and that actually has an impact on the brain the same way a narcotic would, and can actually induce symptoms of anxiety when you eat either too much of it or when you have withdrawal symptoms from not eating it often enough. And so when people experience this, what I often recommend them to do is actually reduce or remove all gluten and dairy from their diet to see if that has an impact on their anxiety symptoms. Keeping in mind that the first few days you do it, you may actually experience a little bit of higher anxiety as a withdrawal side effect, because your body has literally become addicted to these compounds. So from a dietary perspective, again, gluten and dairy removal I've actually seen very effective in my practice. And so I often recommend it as a first step of action in trying to get control over your anxiety. So when we use GABA, it's important that we use the right version of it. I typically recommend a form called Pharma-GABA, and the reason behind that is that GABA does struggle to cross this membrane we have called the blood-brain barrier. And this specific form of GABA called Pharma-GABA has been shown to have better penetration to the blood-brain barrier, where the GABA can actually get in, get to your central nervous system, and have a much stronger effect. In doing this, now one thing is that GABA does have a little bit of a sedative effect, so some people are a little bit more sensitive to that. It may not be the best option for them because it can induce a little bit of fatigue. So before you, especially before you operate heavy machinery, please experiment with the GABA, figure out how it affects you so that you don't put yourself into a dangerous situation. One of the other things I often recommend, especially if you have anxiety at night, is GABA before bed. You know, if you lie down into bed and your mind just starts racing, it's really important to use GABA at that time. Help calm your mind, allow yourself to sleep. This allows your body to heal, and actually proper sleep can even help reduce your symptoms of anxiety. So I hope you've learned something that you can apply to your own life to, again, help understand your anxiety, help manage, and ideally treat and remove your anxiety altogether. So if you've liked this video, please check out more of our natural health videos. You can subscribe, and if you have any questions or comments, please feel free to post them below. And always remember that knowledge is health.